Hi, my name is Nikki Markham and I'm the founding director of Battling On. We established Battling On in 2012 in response to members of the armed forces who were struggling with civilian life. Over the last 12 years, we've morphed, so we're now working with families, with the children of veterans, we're working with people who are transitioning out of the armed forces. So really it's a whole package of wraparound care and support with mental health, providing services for the elderly, for families, and really just trying to provide anything that veterans need. When COVID hit, we were put into lockdown. Now, if you have mental health issues or if you're struggling financially, this became a really big issue for veterans. They're not particularly good at asking for help, and actually being isolated with mental health caused tremendous problems. I mean, we were dealing with suicidal phone calls constantly, to the point where a colleague of mine were actually showering with phones because it was that bad. Many of the big statutory organisations actually closed their doors and went to phone-only services. Unfortunately, if you're in crisis, you don't pick up a phone. You need face-to-face support. And that's really where we came in. During that period, we worked with literally hundreds of veterans providing support. We cooked for veterans, opened up the farms so they could come and get fresh air when we were allowed to. And I think in that period we did over 1,200 meals, outdoors barbecues, to just bring people together in isolated bubbles so that we could keep people sane really, and allow them fresh air and camaraderie. The biggest problem with COVID and the impact is I don't think people realise just what it meant to veterans. They spiral very quickly without support, without being able to get outside. So we were seeing huge increases in alcoholism, self-harming, suicide attempts, marriages breaking down, veterans ending up in the street. It was a really, really dire picture. We also had the issue that the Royal British Legion and Help for Heroes unfortunately closed their offices, so there was no walk-in services. So that left us. And in Plymouth we have over 37,000 veterans, which is a huge, huge population. And even if people were okay before they went into the lockdown, many of them weren't when they came out of it. So fast forward into post-COVID, we are now seeing the legacy where people have developed issues. Their coping strategies were blown apart because of the COVID incident or the COVID lockdowns. And the biggest issue was that the services were slow picking up. We were on speed dial for Op Courage, which is the Veterans Mental Health team. They were visiting us, bringing veterans down here. GPs were referring to us, social prescribers were referring to us, probation was referring to us, hospitals were referring to us, and we saw our numbers literally quadruple overnight. Now, we wouldn't have been able to cope with that without the help of the Armed Forces Covenant Fund Trust. Luckily, we were awarded a 2-year grant that allowed us to work with those that had fallen between the gaps, those people that weren't accessing the statutory services. We were getting people at the point of crisis, but the big trouble with veterans and the way they deal with things is they are not very good at being passed from one service to another. So what actually happened was there was this gap that they fell between. If they came out of hospital after a suicide attempt and they were waiting for a referral into mental health, it could be months, and sometimes months mean lives. And that's where we stepped in. The most significant thing about the Armed Forces Covenant Trust Fund for us was that it allows us, a grassroots organisation that knows the landscape that we're working in, knows where to find the veterans, knows how to engage with all the partners and actually help people in crisis move out of crisis. So thanks to them, we have literally seen phenomenal results. It's been a really rough, horrible ride over the last 2 years. And without the funding, I wouldn't have been able to put the mentors in place that are now working as detached mentors and support workers at community level. And that is invaluable. It means far more than ploughing money into big organisations that actually have huge overheads. We can get every pound to frontline, and that is the power of the Armed Forces Covenant Trust Fund.